Antarctica, April 29th, 1961, 2 in the morning. The temperature outside the station is minus 40 degrees Celsius. The wind is doing what Antarctic wind does, moving at speeds that would knock an unprepared person off their feet within seconds of stepping outside. And inside the Novolazarevskaya research station, a 27-year-old Soviet doctor named Leonid Rogozov is lying on a table in a room that has been hastily converted into an operating theater, about to perform surgery on himself. Not because he wants to, not because he's trying to prove anything, not because he had any choice whatsoever. Because he is the only doctor within thousands of miles of frozen ocean. Because the nearest hospital is unreachable. Because if he doesn't do this tonight, he will be dead within 24 hours. His surgical assistants, a meteorologist and a truck driver, neither of them has any medical training. His anesthesia, self-administered Novocaine. His guide, a textbook,
which he will have to read upside down and in reverse using a mirror because he cannot see his own abdomen any other way. This is not a movie. This is not fiction. This happened. The Soviet government documented it. His medical notes still exist in archives. The meteorologist who assisted him wrote his own account. By the end of this video, you're going to have a completely different understanding of what a human being is capable of when every other option has been removed. To understand what Rogozov was facing, you need to understand where he was. The Novolazarevskaya station sits on a shelf of Antarctic ice. Established in 1961 as part of the Soviet Antarctic Expedition Program, it was home to a small team of scientists, meteorologists, geologists, and one doctor sent to study one of the most remote and inhospitable environments on the planet. During Antarctic winter, the station is completely cut off from the rest of the world. Not inconveniently cut off. Not cut off in the way that means slow mail and spotty phone service. Cut off in the absolute sense. The storms that descend on the continent during winter make aircraft landing impossible for months at a time. The sea ice makes ship approach equally impossible. There are no roads. There is no way in or out. 13 men, one station, surrounded by thousands of miles of the most hostile terrain on Earth. For those 13 men, Leonid Rogozov is not just a colleague. He is their lifeline, their entire medical safety net, the one person standing between them and a medical emergency with no treatment available. And then, Rogozov wakes up one morning feeling wrong. He knows the symptoms immediately. He is a doctor. Lower right abdomen. Sharp, localized pain that is getting worse rather than better. Nausea. A low fever that is beginning to climb. Acute appendicitis. In a hospital, this is a routine procedure. 30 minutes under general anesthesia, a small incision, a straightforward extraction. The patient goes home the next day. In Antarctica, in winter, with no operating theater and no surgeon and no way to evacuate, it is a death sentence. The appendix, if left untreated, will rupture. When it ruptures, it releases bacteria into the abdominal cavity. The resulting infection, peritonitis, is almost universally fatal without immediate surgical treatment. The timeline, once symptoms appear, is roughly 24 to 72 hours. Rogozov does the calculation that no human being should ever have to make. There is no evacuation possible. There is no other doctor. There is no way to contact a surgeon for real-time guidance. There is only him, and the textbook, and the choice. He tells the station commander what needs to happen. The room goes quiet in a very specific way.
The commander asks if there is any other option, any at all. There isn't. So they prepare. They clear a room. They lay out every piece of surgical equipment the station's medical kit contains. They sterilize everything twice. They set up a lamp. They find a mirror. Rogozov's team. Gennady Teplinsky, the station's meteorologist. Zinovy Teplinsky, the driver and mechanic. One will pass instruments. One will hold the lamp and the mirror. Before the operation begins, Rogozov gives them a set of instructions. Not inspiring instructions, practical ones. If I lose consciousness, here is what to inject. Here is how to perform artificial respiration if needed. Here is what to do if my heart stops. He is not being brave. He is being systematic. He is a doctor preparing for a procedure. And the fact that he is also the patient is just one more variable to account for. At 2 a.m, with the Antarctic wind outside and the Antarctic cold pressing against the walls of the station, Rogozov injects Novocaine into his own abdominal wall. He waits for it to take effect. He makes the incision and immediately discovers that the mirror is useless. Everything is reversed. Left becomes right. Up becomes down. The spatial information his hands are sending to his brain conflicts with what his eyes are showing him through the mirror. He cannot process it fast enough to be accurate, so he stops using the mirror and works by touch. No gloves, because gloves would reduce the sensitivity he needs to find what he's looking for. Bare fingers inside his own body, navigating by feel toward an organ he has removed from other people but never approached from this angle, never from this direction, never while simultaneously experiencing the sensation himself. Every 5 minutes he stops, closes his eyes, breathes, waits for the dizziness to pass, for the trembling in his hands to quiet, for his concentration to sharpen again. Gennady, the meteorologist, holding the lamp, goes completely white. He is keeping himself upright by willpower alone. Rogozov, without looking up, tells him calmly to keep the lamp steady, and keeps going. 45 minutes in, his fingers find what he has been looking for. The appendix. Dark, grotesquely swollen, on the verge of rupture. Another few hours and peritonitis would have been inevitable. With the last reserves of concentration he has, moving with as much care as his shaking hands will allow, Rogozov removes it. He irrigates the cavity with antibiotics. He sutures the wound. The operation takes 1 hour and 45 minutes. When it's over, Rogozov accepts a mild sedative and sleeps. 5 days later, his fever breaks. 7 days later, he removes his own stitches. 2 weeks after the operation, Leonid Rogozov returns to his regular duties at the station, as if nothing unusual had happened. The Soviet government awarded him the Order of the Red Banner of Labor. His medical notes from the operation were published in a Soviet Antarctic research journal in 1964, where they attracted significant attention from the medical community. Surgeons who reviewed his notes found the technique competent and the outcome remarkable. He went on to have a long career in medicine. He lived until 2000. And here's the thing about Rogozov that I keep coming back to. He never described what he did as heroic. In his own writings about the event, he describes it the way a mechanic describes fixing a difficult engine. A problem presented itself. He assessed the available resources. He executed the solution as carefully as the conditions allowed. The solution happened to involve cutting into his own body in Antarctica in the middle of the night. But in his framing, that was just the situation. That was just what the problem required. There is something about that framing that I think is worth sitting with. We tend to think of extraordinary acts as requiring extraordinary people. People who are different from us in some fundamental way. More courageous, more capable, more built for difficulty. Rogozov doesn't read that way. He reads as a person who encountered an impossible situation, accepted that it was real, assessed what was actually available to him rather than what he wished was available, and then did the work. He didn't overcome the situation by being superhuman. He overcame it by refusing to accept that the situation had already won. Hit like if Rogozov earned it. Subscribe. 3 days, next story. See you then.